All right, I think we'll go ahead and get started for the afternoon. Welcome to all of you and good afternoon. My name is Mary Martell. I am the Director of Education with the Pathways Community Hub Institute. Very excited to be with you this afternoon as we explore the PCHI model and its work and its interaction with health literacy. I'd like to just pass it off to introduce the rest of our speakers on our panel today. Isaac, I'll pass it off to you and then we'll just go around before we get started.
Awesome. Thank you, Mary. Hi, everybody. My name is Isaac Baez, pronouns he, él. I am the Assistant Director of our Training Education Department. I'm super happy to be here with all of you, and I will pass it to Chanel.
Good evening. I apologize that I am not on video at this moment. I'm running behind, but my name is Chanel Harvey. I'm the Hub Director at Stark County Community Action Agency.
Awesome.
Hello, everyone. My name is Panther Sperlin. I'm a community health worker underneath Stark County's Community Path and with Access Health.
Well, again, let's welcome to all of you and welcome to all of you here who are joining us today as we continue our conversation. So I would like to just begin a little bit just to tell you a little bit about the Pathways Community Hub Institute and the PCHI model, as we term it for short, that we will be speaking about today. So we're going to start with a brief introduction via a video that we have that just explains a little bit about the Pathways Community Hub Institute model. So Isaac, do you want to go ahead and share that video with everyone?
No matter the health indicator, from infant mortality to the burden of chronic disease, long-standing inequities exist. The Pathways Community Hub Institute was established to help communities advance health equity by implementing the PCHI model. Pathways Community Hub Institute innovates with communities to build transformative and sustainable care coordination networks called Pathways Community Hubs. The PCH is community-owned and builds health from the ground up. Its sustainability is achieved through a payment model linked to meaningful and measurable outcomes. PCHI model certification standards provide communities the blueprint for building a Pathways Community Hub to fidelity. A nationally certified PCH improves health, reduces costs, and promotes health equity. The PCH serves as the air traffic controller for community-based care coordination. It is dedicated to optimizing the use of local resources, ensuring greater efficiency and effectiveness in addressing complex health-related social needs. It contracts with funders and existing community-based organizations that employ community health workers to connect with those most at risk for poor outcomes. The PCHI model was designed based on the ability of CHWs to build trusting relationships with community members. The PCHI model provides training and tools for CHWs to identify a person's individually modifiable risk factors and work towards eliminating those risks one by one using 21 standard pathways. A pathway defines the steps needed to achieve a specific measurable outcome. If an outcome is not reached, then a pathway is closed and marked finished incomplete. But the CHW's efforts to resolve the risk are recorded. The PCH shares that information with the community to develop solutions. So, how does this actually work? A CHW finds a community member, Anna, who isn't keeping her medical appointments. After the CHW checks in with her PCH to avoid duplication, she schedules a home visit with Anna. The CHW discovers that transportation is part of what's keeping her from her appointments. Anna also doesn't want to tell her doctor that she isn't taking her medications. As the CHW works with Anna to remove barriers, she opens several pathways to track Anna's progress: medical referral, transportation, medication screening, and a learning pathway about medications. Each pathway stays open until the risk factors are resolved. The medical appointment is kept, transportation strategies are in place, a list of medications Anna is taking is shared with her doctor, and she has a better understanding about her medications. In the model, 50% of payments are directly tied to completed pathways. An outcome-based unit accompanies each pathway and is a measure of the complexity and time needed to resolve the risk. PCHs collaborate with grant funders, government agencies, health plans, and more. This alignment of payment with outcomes is a cornerstone of the PCHI model, providing incentives to address complex health and social needs. Used by communities for decades, studies demonstrate that individuals who are enrolled in a certified Pathways Community Hub have improved health and reduced costs compared to those who are not. The model is replicable and scalable to any population with health-related social needs. Today, the PCHI model is being used in almost half of all states to advance health equity in rural and urban areas. At PCHI, our unwavering focus is on forging connections, dismantling barriers, and supporting healthier, more resilient communities. We firmly believe that every individual deserves access to comprehensive health and social care, paving the way to a healthier future.
All right, so just a little bit of an introduction about the work and the Pathways Community Hub Institute model. But before we dive into our conversation, I just want to elicit or request that, as an educator, I love interaction. So I encourage you to please, as we go along, feel free to ask questions. You can do that by raising your hand. You can do that by tapping that Q&A button at the bottom of your screen and typing in a question, or even via the chat function where we can be monitoring that and answering your questions along the way as well. But really want to be able to engage and interact with you as we continue through our discussion this afternoon. Okay. So we heard a little bit on the video about the model of itself, right? And really the foundation of the work that the model uses through that Pathways Community Hub to engage in those interactions and those relationships with those community members. However, what I want to do is highlight the focus of our conversation today, and we are so honored to be joined by a community health worker in the value and really the importance of their participation in this entire process. Without community health workers, the work doesn't exist, right? And so while we explore the model in itself, coming it from a lens of that, in the sense, the model's the model, but without the CHWs that we call community health workers for short, in our communities, engaging with our participants, the model just stands alone. So we are fortunate to have Panther with us today. So really excited to hear from her experience as well. In addition, right, Isaac and I are from the Pathways Community Hub Institute. However, without those in the communities to serve as the PCH, to be that air traffic controller, as we heard on the video, again, this model is just a model without the implementation. So happy again to have Chanel with us today as the director of a PCH here in Ohio, to be able to share with her experience as well working with the Pathways Community Hub Institute and its model. Okay. So Isaac, I think do you want to just kind of think about where do we want to start, right? Understanding a little bit more about the CHWs and their role? Sound like a good plan?
That sounds good.
So I think that, first let's take a look about, a little bit more in depth of how do CHWs engage and what is their role within the model in contributing to addressing health inequities. And so really the primary role of a CHW is in their ability for care coordination, right? Really working with their participants to coordinate the care as risks are identified. And really, the value or importance of what a community health worker does, it lies in the fact that they are really standing in between what we call, often say is the two different worlds, right? Where they have to have one foot in that world of their participants and working within their communities and within the homes, while having their other foot standing with service providers, with healthcare teams, and being able to bridge the gap across the two, what often we see are very different worlds. And so that is where the key for community health workers comes in. In addition to that, They're able to link what those identified risks that they have worked with their participant to discover to the 21 standard pathways of the PCHI model. It is being able to translate those risk factors to those pathways that really helps guide the work that a community health worker does. Each pathway within the model is evidence-based, so stating that upon their completion, or as that CHW works with their participant to complete those steps within each pathway, they are moving towards mitigation of those identified risks and overall better health and well-being. So really important that CHWs have in this whole process, because what we often have found, right, is that many of the communities and populations that the model really aims to look to serve are those that often come up against barriers, who often come up against, right, dead ends, or even just the lack of knowing how to access resources. And so that CHW's experience, being able to help sort of walk that journey with their participant, is really key as we look at risk mitigation and that behavior modification, ultimately looking to move towards health and well-being for that participant. Okay. In addition to that, the PCHI model enables the CHWs to look at identifying and addressing medical as well as social risks. Well, one thing that you'll hear often said by our organization, and I think anybody working within this model, is the simple fact that, one's health isn't about just going to the doctor, right? It's about looking at all of those other social determinants that are impacting that individual's well-being. And so when we look at those 21 pathways, what we really are looking at is those different areas of social as well as medical health for that participant. And so through the licensed content forms that the model does provide, CHWs with their participants identify risk. Now, one thing that really is sort of sets apart the PCHI model is the fact that it is really a partnership with the participant. We always say this is a participant-driven model, meaning that the participant's the driver in this process. The CHW is sort of the navigator, right? They're helping that participant navigate to get their medical or social needs met. But ultimately, it's the participant's decision how this sort of process works. And so I see Panther shaking her head with that. So, but Panther, please feel free to jump in if you want to add to anything. Definitely would love to hear from your experience as well. So.
Yeah, I mean, you kind of said it all. I'm not sure where to go from there. I do want to focus on the key aspect of that last part, is that we are here as a partnership. So I always, tell my clients, I'm here to be your voice. I'm here to, help you get to that next level to where you don't need me anymore. To where, even if you get into this type of bind again, you know how to navigate it in a different way. I get clients who are brand new to areas. I get clients who are young, who are old, all different types of backgrounds. And they usually all have the same types of issues of just, I distrust the healthcare system, or I don't know enough about the healthcare system. So all those things play a part. So when you are me as a community health worker, and I'm sitting down and I'm listening to all their needs and coming from a place of where, yes, I've also used these same resources. I've been in the same shoes that you have been. I understand exactly where you are coming from, even though you have a different narrative, a different viewpoint from it. It allows that client to trust me. It allows for them to say, okay, I'm not crazy, or I'm not in this position by myself. And then from there, they're able to want to set goals. They want to be driven. Some don't. Some want you to just be holding their hand the entire way. And you can but you still have to let them know, like, at the end of the day, we want you to be able to not need us anymore, to be able to thrive and just do well. So, just that partnership is really key, and to let them know that they are in charge of everything that they do.
Yeah, I'm gonna jump into I love what Panther came up and said on that perspective of not only um, understanding the community, but understanding what the communities have to navigate. And so that's kind of part of the idea of the model, not the idea, but kind of the core message of PCHI when it comes to what the model has to entail is how do we come together as a community and support those who have a lot of vulnerabilities, who have a lot of barriers of social determinants of health, and even including health literacy as one of those gaps because of not understanding the systems. And a lot of times we look at health literacy, we think of not understanding what the doctor is telling us or not understanding what the medication is giving us, but really looking at health literacy in a broader lens. So what is it that we're trying to figure out? I'm trying to understand the system alone. And the system has a literacy level that I might not be able to navigate, understand. It's the same thing as when a person walks into a new job. A lot of places will talk in jargons, they'll use abbreviations, and they're like, pass me that TLC with the FLT, and then you're like, wait, what does that even mean? And that's how a lot of these participants, which could also be known as patients or clients, depending on what you call them, we refer them as participants because they choose to work with us. They choose to share their stories and their vulnerabilities as community health workers are working along their side. So a lot of the focus is really entailed in trying to um, help them understand, be kind of like interpreters. It's not even in from a different languages, it's also being an interpreter in the same language that we are speaking and being able to have that. So Panther is like, oh, I got you. I know exactly what you're talking about. I'll get you. This is a document that they want. When they said this form, that was this form over here. Or you know what? I might not know this, but I'm gonna find someone else who might be able to have because it is a full network. And that's the one thing that we also try to make sure that we have people to understand. This work is not done by ourselves. CHWs are those frontline public health workers who are the boots on the ground doing the work. But a lot of it is there's coordinations and working together and figuring out how do we actually get everyone to come into the same space and saying, okay, we need to figure this out and how to coordinate this, or I need to figure out this information, or who do I go to when I need to figure this out because they're needing this form or this support. And so there's a lot of community work, and that's kind of the aspect that was taken when this model was delivered, because it was not intended to be its own, but it was intended to figure out how do we fit within the community and figure out how can we actually support them in a way that they understand, in a way that they feel comfortable, and in a way that they really feel supported and not feel like we're just coming in to do something and then walk out. And I'll pass it back to you, Mary.
Yeah, absolutely. And Isaac, what a great segue to bring in Chanel, as Chanel is the director of the Pathways Community Hub in Ohio. So Chanel, share with us a little bit about, your experience and the work that you're doing in Ohio in your communities when it comes to the PCHI model.
Yes. So, thank you for having me. One thing that I love about the CHWs and how they engage our community members is that, as Panther already hit on, they share lived experiences that our clients or participants have dealt with. They they've had the same, if not all, of the struggles that our participants have with complex health and social needs. And our CHWs, they're able to speak our clients' language. So, and then they can translate it to fit the PCHI model by documenting their interactions for pathways to translate to invoicing. I always tell the CHWs and our team, if it isn't documented, then it didn't happen. So I even have a sign in my office that literally, and my program coordinator as well, that says, but did you document it? So the CHWs, they have to, it's almost like even if they don't speak a different language besides English, it's like they're still bilingual or multilingual because they have to take their interactions with our clients and then translate that into documentation that the Medicaid providers can interpret and therefore reimburse their services, making their positions sustainable. Another way that they engage in the community is through various events that help them connect with potential clients or even their current clients. So some examples, pop-up events like we have set up at the SARTA Transit Center, just to disseminate information about what we're doing and the services that are available. We host community baby showers, and then even the CHWs just canvassing the community on their own. So that could be anything from social media engagement to just seeing someone in the community that you think may need your services and just finding a way to engage with them. Again, you know, that's sort of where I think class comes in. How do you approach somebody that you think could use your service without offending them, but letting them know that you're there to help? And then also just utilizing our community partners so they know, those that really know and understand the work that our CHWs do, they will reach out to us when they have different clients come into their office or their agency, and they will make that referral. So that way our community health workers can get in and really get to the bottom of things and help them address those complex needs.
Absolutely. Great work. Great work you guys are doing in the community for sure. Absolutely. But so yeah, I mean, I think a lot of good conversation already, right? Thinking about how looking to empower our communities, empower our participants. That is the one thing that the PCHI model and CHWs really are driven to do, right? I think, you know, Panther talked about, you know, teaching them, right? So that the next time they encounter this barrier or this, they have the skills to be able to maneuver through it. So very important. And as well, and you know, Chanel again echoed, right, that lived experience, knowing how to talk to your communities and those individuals, being able to translate some of the language, not just from different, you know, languages itself, but in a sense, even just simply into dialect. So really important. And so with that, you know, want to talk a little bit about that incorporation of culturally and linguistically appropriate services as it's integrated into the PCHI model. And, you know, a little bit about, you know, Isaac, why is that important for promoting health equity? Oh, you're muted.
I am going to share my screen, and I am going to share you just a snapshot of what the National Standards for Cultural and Linguistic Appropriate Services. I think this is something that's super vital for any organization or system that is trying to figure out how to appropriately serve different communities, and not in just multiple languages, but even in English. Like, how do we communicate? How does our marketing work? How do we communicate with someone who is from the ASL community? How do we communicate with someone who's blind? There's different methods that need to be approached. So the United States Department of Health and Human Services came up with these themes. There are 15 themes, one main theme, 3 main groups, and 15 standards in total. The principal standard with 14 other standards, and each of those standards touch a different component that can be approached in a way that can help a system actually navigate on where to go and what to do. So I'm going to share my screen real quickly, just so that way you have an idea what it is. This is something that you can search online in the United States Department of Health and Human Services through the Office of Minority Health. Were the ones who actually came up with these standards. So give me a second. I'm going to try to pull the thing up. All right, so these are the National Standards for Cultural and Linguistic Appropriate Services, right? Which is also known as CLAS, for health and healthcare services. If you look for this, you will find an actual blueprint document that kind of navigates and gives you examples on how people utilize these standards in a different approach. If you even go into the main aspect or component of the principal standard, it is about providing effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs, practices, preferred languages, health literacy, and other communication needs. Just the principle alone is an overarching component of thinking through the health literacy lens on how do people understand what we're trying to communicate. Are we giving them the message or helping them understand what they need to understand in a way that they can? And this is the beauty of how the model and even community health workers are able to kind of navigate these worlds, because a lot of the information is super high in the reading levels. A lot of times it's really confusing on what to do and how to navigate it. But then you have our community health workers really grabbing all that information and translating it in a way that a person can say, oh, that's what they're trying to ask for. So it really dives into understanding this approach. And when you get the blueprint, you're able to go into a deeper level of understanding each standard itself. Um, the first theme after the principal theme is really going into governance, leadership, and workforce. But the one that I want to make sure that you understand, especially in the health literacy component, is really the communication and language assistant, which is where we offer that assistance for those who have limited English proficiency, or also known as English language learners. Those are two different ways to talk about them. How do we inform all individuals of the availability of language assistance, ensuring competencies of individuals providing the language assistance, and then even providing easy to understand printing, multimedia materials, signage. So even like if you do a walkthrough of your organization, do you have things in a way that people are able to understand? Are your letterheads, are they big enough for people to read? Do you have signs that are just too small for people who might have visual disabilities and not able to see it? Do you have a way for people to understand, to navigate and say, oh, they can provide interpreter service, or they can get me my documents translated if I ask them for it, and not feel ashamed of it? Not only that, do we even try to talk to our participants and figure out, are they even able to read? Do they have good reading comprehension on what they're trying to fill out? Do they need support on this? So really, even though these standards are very broad, they're meant for people to dive in a little deeper. And when you're kind of crosswalking it compared to what your organization is doing, what is it that we need to do to really fulfill this standard on its own? And I know I skipped over the first part, which is the governance, leadership, and workforce. This one does really talk about education and training and making sure that people really understand it. So, of course, coming to trainings like these, getting education on what it means to really help community members, learning more about different models that exist, and understanding what are different ways that these can be implemented. And then the last one, when it comes to engagement and continuous improvement accountability, is, are we checking in with the things that we're doing? A lot of times we do our stuff, we give our information, we even get things translated, but we never check in with the community to see, is this information actually important for them? Is this something in a way that they understand? One quick tip that I can share with you. I like to, when you translate any information or any material, for example, let's say you want to translate it into Spanish, make sure that your reading level is at a good reading level just in English alone before you even get that translated. After you get that into a good reading level, translate it. One good practice is, not only should you translate it, have it also translated back into English. If you're seeing that the information is able to go back into English, this kind of similar to what you have it, then you have your good document really well translated in the way that it needs to. If it's being translated and it comes back and it's like really off, like it doesn't make sense, that really tells you that maybe even the information is not translated. But another thing that I also recommend is talk to the community. Have volunteers, if you have committee groups that can look at the material and information that you have. And if someone speaks that language, you say, hey, can you read this brochure or this pamphlet or this information that we have? Does it fit to what the community needs? Will they be able to understand it? Is this something that they would appreciate, or are there terms that we need to fix or change? It is a good way for you to get even input information. So if you want to be accountable, if you want to make sure that you're doing things right in a way that it's engaging, and even to continually improve the work that you're doing, you have to figure out ways to be vulnerable as an organization, open up, and make sure that you're connecting to the community itself and seeing, hey, does this make sense for you? Because you're trying to connect with them. And if you're really trying to connect with them, you have to make sure that you're following through not only with the guidelines that we have out there, but does the community actually understand and can really receive this information overall? And so these standards really have a good way of kind of, what do I do? How do I do it? They're very overarching. There's a blueprint that can get into the details, but really is thinking on these standards. What is it that we can do to get there? That really can show that we're following through and that we're really bringing this information in a way that our communities can understand it. And I'll stop sharing right here.
Awesome. Thank you, Isaac. Really good information. And definitely, as we look at those class standards and how can we incorporate them into our own work that we're working on in our individualized agencies. Panther, anything that you would like to share in terms of, have you found any resources or even opportunities to address looking at, working with class with your participants or engaging with those participants with needed resources when it comes to the class standards? Or even any challenges, I guess I should say.
I'm more so, it's more so in relates to just understanding what they're, I'll give an example. So I'll have a participant who does not understand, they just signed up for Medicaid, not understanding what all is in the background, like just that narrow platform. I don't understand what this is, like what's transfer, like I didn't even know there was a member services, things of that nature. So I find a lot of just, what is this? They're new to Medicaid, or they're new to Medicare, or they're not understanding what's going on. So I deal with a lot of those issues.
Yeah, so really being able to break it down, right, and be able to get that information to the participant or the community in a way that they can digest it. And I think, Isaac, that's sort of what you were speaking to as well. What does that need to look like? I think for us, when we look at coming from the model perspective, some of the challenges that we've noticed in incorporating class into care coordination models, like the PCHI model itself, is just finding those available resources to be able to effectively engage or connect to those services. And then I think Isaac spoke to, in addition, going back to analyze, right? Really looking at, are the techniques or the services or the resources that we're using working, right? Isaac, you had mentioned, right, just translating into Spanish. And I think you and I had a conversation not too long ago where even translation into Spanish in different communities, that translation can actually be flipped, right? I don't know. Can you speak to that a little bit and share what you were talking there?
Sure. So I'll share a little bit about my personal story. So I am Puerto Rican Dominican. So my Spanish is very Caribbean. So if you put me in Cuba, Puerto Rico, Dominican Republic, we have a lot of similarities. But if you put me in Mexico, it's going to change. So there are terminologies that don't mean the same for each other, even if it's the same word. So the word, for example, ahora, means now for me, but for people in Mexico, it means later. And then the word later for me is ahorita. It means now for them. So if I'm working with a participant who's Mexican and I say, I will see you later, or I'll see you ahora, they'll think that I'm going to see them later when I'm really just trying to say, I want to see you now. So they'll be at the waiting room and I'll be like, I'll see you. It's like they're like, wait, are you gonna see me now or do I have to come back for my appointment? And it's like, no, I'm gonna see you now. And it can really have a misinterpretation. So even trying to translate information in a general language where everybody in all Latin American countries can read it and understand it is also a technique on its own. Because the way a person speaks in each country can be very different, and their influences, their wording can be very different. And so, how do you properly get that message in a way that everyone can speak it? I'll give another quick example too. Um, there was another organization I remember, they were trying to translate their information. They got it into Arabic. It was supposed to be an intimate partner violence agency, and part of the shelters is to keeping the shelters in a safe location. So in English, it says we're a shelter. It's a safe location where no one can find you. Well, in the Arabic term that they use, because someone took the brochure and said, hey, they went to this person that they knew from the community who helps out a lot and said, can you read this brochure for me and see if it's in Arabic, if it's okay, because they didn't speak Arabic. And so what ended up happening was that the word that they used was in a dark reference of, we will keep you away where no one can find you. And so instead of protecting the person, it was a point of, yeah, no one's going to ever find you here. And it felt like, are you going to kidnap me or, take me away? Just a simple word with a different context can really change the language, the meaning, the essence of the message that you're trying to say. So you have to be very careful. We're using a lot of AI, there's a lot of technology. You have to be careful when you're using even those things to help translate information, because it can really divert someone from saying, oh, they're not going to be able to help me, or they don't understand what I'm saying, because misinformation is being handed to them and it's not really getting the message to the way that they understand. So you really have to know your communities, know the way they speak, and make sure that you're giving that information in a way that they understand. And that's why I always refer to checking in. I have close friends who speak Spanish, so I tell them that they're volunteering for me, and I'm like, here's your volunteer hours. Read this for me and tell me what you think. And they're like, why are you giving this to me? I'm like, because you know what the community likes or can read. And so if you don't give me that feedback, I won't know if I'm really doing a good job or not. So utilize your community, work with your community, work with your CHW, say, hey, do you mind talking to this participant and saying, can they read this? And and ask their feedback. Get the feedback. It is the best way to say, all right, now we can edit it, fix it before we print it out. Because then it can cause problems and people are like, oh, that's really bad. I didn't like that. So check in. It's a way to check in.
I, I would also like to add to that. So, sort of shifting a little bit, but just looking at how class enhances the quality of care. So, one thing that I try to remind our team is you never know what happened to someone 5 minutes before they walked into the room, just like they don't know what happened to you 5 minutes before they encountered you. So always try to operate in grace. And I think honestly that is something that Mary taught. Mary's my predecessor as the hub director. But I think that class is more than just that language barrier and how do you communicate, but it's also extending grace, because sometimes just in that moment, depending on what is going on in their life, when you extend that grace, that might be a game changer for if you're able to engage them. You might not even be able to resolve whatever is going on, but that might help them get their attitude together with how they go to the next person that they're going to encounter as they're trying to work through their issues. So just something else to consider outside of just a language barrier or being able to speak to someone on in different levels of professionalism and things of that nature.
Great point, Chanel. Absolutely. Right. Looking at that holistic picture, not in just such a narrow view sometimes. And that's often what we see, right, when it comes to class. How do we translate something? But there's so many other factors to really consider and bring to the forefront in the discussion. So Isaac, I just want to ask you, you talked a little bit about feedback and getting that feedback from the community, but are there any other best practices that you would recommend when it comes to CHWs and building that health literacy in, the underserved populations, looking at those social identities and cultural contexts that you would like to share with the team. What else can people do in this area?
I think another part is making sure that people have a better grasp on the demographics that is in the communities, because a lot of times we forget to check in. Things change, things morph, people move in, people move out, new groups come through, younger generation comes through, or maybe it's just still an older, like who is in your neighborhood? Have you checked in to see the data, what's going on, what's being updated? Because a lot of times you can come in and think, oh yeah, we've been working with this group for the past 15 years. And then all of a sudden there's a new group that starts walking through the door and you're like, I was never ready for that. So staying connected to your other local community organizations, if you have refugee resettlement agencies, if you have other organizations that work with different populations, having a check-in and saying, hey, have you been noticing that this community has been popping up or coming through the doors? Are we ready for that? Or do we have accessibility for that? So are you prepared to adjust or support depending on the needs of the group? So even for CHWs, if you think about the amount of people that they're going to encounter, they're going to be that first person they're going to have those interactions with. And then they're running back to the hubs and to their organizations and saying, I need help with this because this is actually happening. So are we prepared? How do we get ahead of it, before it really gets out of hand? Because then it's all this frantic running around. Do we need this? Have we had this translated? So even thinking about, okay, maybe I can't get everything translated, but who are my organizations that I can talk to translate things if we need it? Maybe I've never had a person who is blind, but do I have accessibility of knowing where to get Braille information? Maybe I've never encountered someone who speaks American Sign Language, but do I know where to go to get translated interpreter services that have American Sign Language? What are the other informations or resources? So utilizing the class standards in a way that can actually prep all the stuff that you might need to actually get ahead. And then even supporting then the CHWs who are really trying to navigate that, because they're going to be that front door. They open that door, they have those encounters, they start the conversation, and it's like, oh, I need this other information. Or I didn't realize that this is something that this person might have needed. And so how do I get that information to them in a way that they can understand? And then even making sure that our CHWs are getting good training in the sense of understanding different cultural components. So even letting them get time to actually have and navigate that stuff. Because a lot of times it's not just the experience of working with a person, but it's also being able to get some training to of those communities that they're coming through. So, working with other groups that can share the stories of those communities. So if Panthers never worked with someone Latino, I want to get her to go, hey, go to this place and get this work with some Latino community members, and here's a little bit about their story. So that way she's ready to encounter and have a better connection with those communities, because we might live in the same neighborhood, but there's still a lot to learn from each other.
Absolutely. And Chanel, I'm going to ask that for you to piggyback off that, what Isaac was just speaking about. But, can you share any like workforce development strategies that you have kind of experienced or used in your community to strengthen those community health workers' ability to meet that health literacy needs?
Yes. So one thing that, as I was preparing for this panel, I feel like class development needs to happen from the top down. So the CHWs and those of us that are truly invested in the work, we have pretty much mastered engaging in the community and connecting them to the community services, and we're aware of the different issues. But one thing is that a lot of the development strategies that need to take place need to happen at the top down. So those people that are in the decision-making seats of writing laws and policies into place that are full of red tape to securing the assistance that's needed to address the complex health and social needs that they claim they want to address, you know? So do we all need to be developed? Yes. So I'm not perfect, you know, I still need to grow. There's things every day I feel like there's something that I'm like, Chanel, you got to do better in this area, or you need to do some more research so that way you're more well versed in how to handle, you know, that particular population or whatever the case may be. But you know, there's the saying, attitude reflects leadership. So if we really want to right the ship when it comes to class in the landscape for health literacy, I truly believe that it starts at the top. So, you know, if we want the results at the bottom to really address and resolve those social determinants of health, then the top decision makers need to be more well versed or trained in how to address these needs, like what is really needed. So don't give me $1 and say go solve world hunger, but then tell me you can't pay the staff that's going to go buy the food. Like let's work on getting rid of the red tape so that way we can truly address the issue. But yes, ongoing class training, not just for the CHWs and people in my position who are sort of overseeing those programs, but those that are in top that are writing things into law and developing
Yeah.
these policies that make it more difficult for us to actually do our job.
I'm gonna add one thing because it's very interesting when you read the class standards. It says from top down too, like it is everybody. I mean, if you really look at the class standards, it even mentions board members. When they go top, they go all the way to the top, all the way to the bottom. And so are people actually taking the time to learn everything to really, because those who have power to make decisions and changes should be understanding this overall. It is not intended for one group or pushing it all towards one side and then causing those barriers for people not to be able to complete those tasks. It really tells you. And so that in my head, I'm like, I'm encouraging you to get the blueprint. I'm encouraging you to look at it because I want you to see that it's not intended for just one person. You know, it's fine that Panther, Chanel, even ourselves, we're all understanding, but we know that there's a lot of bigger systems that really need to understand class standards, all of it, because we are all doing our parts. We are bits and pieces of this puzzle and trying to be put together, but we can't expect for this piece to fall in place when we're also blocking it and then giving them a misshaped piece and saying, "Here, figure this out." And you're like, where? Where do I put this in if I can't even fit this in this puzzle? Because you're blocking it. It's not the right piece. It doesn't make any sense. So I think that I love that you brought that up because it is so important, but it is there. It says it, and if we are going to apply it, get ready to apply it because it's across the board. It's everybody.
Yeah, absolutely. And looking at it from not just, right, what's written in policy, but is it even applicable or can it be implemented? I feel like so often we have these policies and it's like, but when you go to put it in action, it just puts up barriers, right? So really being reflective of that. I always say, let's check ourselves, right? We all also have a personal responsibility to look at ourselves and where we are at, and how we are either interpreting or supporting, or are we actually inhibiting, right, the development of some of this um, through our community. So thank you guys. I think such a great conversation on really how do we do this, right? Where do we begin? And you know, Chanel, you brought up a great point, right? We have to begin from the top, and that's really where it needs to start, for us to be able to make any of that movement forward. So, within the model, I do want to touch base very quickly, or just for a moment, on part of the PCHI model does look at what we have as developed, what we call learning modules. These learning modules are really to look at the identified risk and how can we use behavior modification to look at implementing change to address some of those risk factors. And so, looking at the model and those learning modules themselves really allows the CHW to develop a sort of a personalized care plan as they use these learning modules with their participants. And that really fosters that behavior change. And so, what we're looking at, I'm an educator, right? So, I'm going to say, education is power. The more information we can provide to our participants to build those skill sets and to give them that knowledge and understanding to make those informed decisions as they move through this process is very key. So, Panther, can you share a little bit about your experience with the learning modules and how you maybe have witnessed, or do you have an example of how working or educating those participants in these particular areas has elicited that behavior change for them?
Yes, so I'm a fan of the learning modules because I want my participants to be able to understand everything that I'm giving to them. So like with one participant, we worked on budgeting because one of the pathways we had opened up was with housing and things of that nature. So we worked on what are some ways we can prevent you from having to be in certain situations. So going to the learning modules, printing out budgeting sheets and working with her each time to learning how to manage her money as a new mom and everything, and with that she was able to kind of see the breakdown of where her money was going and things of that nature. But it's a goal, so that at the end she's like, okay, you know what, I've been budgeting, I've been doing this and that, and it's flowing, and now we can close and move on. So the learning, it just allows me on my end to know if we're making any strides or any progress. But I love the learning modules and being able to, engage my clients with those.
Right, such a key piece, and just sort of elucidating. And I think you make that great point, right? This is a partnership, we're going to do this together. So in the learning modules, we're not just providing the educational material, but we're also the CHW is looking to really work with the participant on how do we build this into your daily life, right? How does this work? What can you change? And so if we look at something even as like stress relief, right? How can you build in some of the education that we provide you regarding stress relief techniques into your daily living? So, can we incorporate once a week doing something, or maybe once a day if that's possible? Really working with the participant on that individualized level with that personal plan, and saying, how can we help you, not just teach you what to do, but actually help you figure out how to do it. So again, a really important piece when it comes to, sort of putting that information into play. And for me, that's also part of the health literacy, right? Not just understanding what we're asking you to do or what is beneficial if you could do, but also figuring out, how does this work in your daily lifestyle? And how do we incorporate that? So very important piece. Isaac, I want to talk a little bit about addressing, some of the emerging health and social needs, and really looking at, some of that rising mental health needs that we're seeing in our communities, specifically our under-resourced communities. So how do you see the model really working towards that risk reduction?
Sure. I will say this has been an area that has been coming up a lot in the past few years. I think with the pandemic, a time in our lives that we all want to erase. If there was a period that we can eliminate from the history books where future generations like, what happened in 20? Let's not talk about it. Um, I think at that time, with the social components of not being able to interact with people, and even seeing introverts who thought at first that they were fine, but then all of a sudden they were like, I'm not okay either. I think it really spoke volumes of the need of human interactions to, for each person, it could be very different. But really, when we talk about CHWs working with individuals at that time, it was so hard because it was hard to not connect and be a support. And family members couldn't see each other at the hospitals. People were not able to access the same areas. If someone had were immunocompromised too, it was very difficult for them to just leave their house. If you were at a certain age and had chronic disease, it was hard for you to leave your house. If you needed access to food or transportation, that was even becoming harder. So a lot of barriers got really heightened. And one aspect that really kind of exacerbated, I will say, is the mental health component. And conversations actually started occurring a lot more on how do we actually see this model in a component, because in the model we have an aspect of mental health, but we really need to do a lot more deeper work of how do we connect and get those resources available for our participants. So we even encourage in the model to utilize what's called our PHQ-9. We do or PHQ-2 to see how they are, where they're at, and then lead it to a PHQ-9, and then from there figuring out what is the kind of support or mental health need that that person actually has. But really taking in that into a consideration, because a lot of things that are happening in that individual's world can be very overwhelming. And then how do I ask somebody to navigate the system when they are feeling overwhelmed, when their mental health is not okay? I can't expect you going through trauma, hurt and pain, and then go, hey, by the way, we're gonna go into your doctor's office and get this appointment, or we're gonna go to a housing appointment and you can fill out all these paperwork. Their mind is blank. And so when we do check-ins, when we're actually figuring out, okay, how do we actually navigate this? This is a good time because again, we're talking about health literacy, yes. But if an individual is not okay, then we really need to figure out how do we get them that support too, because really this is a very holistic approach. It is not just I'm going to help you with food. It is really going, okay, I'm going to help you with food, but what's happening that you don't have food? I'm going to help you with housing, but what is actually causing barriers for you to continue to keep your house? Let's talk about a job that you're trying to get. What's happening that you're not able to keep a job? It's finding the real core problems. So right now, when we are able to have those risk reductions where we're preventing these things from happening and getting people connected, we're actually able to um, have people get to those resources that they need. And so definitely is something that um, it's an area that we don't have a lot of resources, but we really have to figure out as a community where do we come together for this. I've seen people. I will give an example. I know of a group of Latino community members, especially those who are undocumented. Um, they created kind of a peer support group between each other to be able to help each other out in a way that is being able to talk about what they're going through, their mental health needs, and then figuring out how to incorporate. So they were taking things or components that they were learning, breathing techniques, ways to meditate, just different angles, and figuring out how do they bring that into their culture, into their community. And so that is definitely a different way to actually do that. But how do we actually then connect with our CHWs who know the communities, understand it, and say, hey, what can we do to actually figure out ways to actually help and support our community members? So I definitely will say that this is an area that is really coming up a lot more. Not to say that it never existed, but it is so heightened right now in our community that it's something that we really cannot get away from. This is definitely a way. And so even though we do have pathways that get there, trying to get people to the right support, the right help, the person that can actually listen to them. Same thing as navigating a medical doctor, right? You need to go to the right doctor, the one that understands you, the one that will listen to you. In the mental health component, then really figuring out how do we get them into that component or into that right therapist, that right counselor that can actually listen to what they need. And I'm interested of wanting to see your perspective, Panther, of what are some of the realities that are existing or happening currently right now in the community where you serve?
And this is in regards to mental health, just to be clear.
Mm-hmm.
So, whew, um, what I'm seeing is that I don't feel like there is a I don't feel like there is a quality amount of mental health care out there in my view. I like you can have a mental health service, but that doesn't mean that they are going to be able to respond to different cultures and different backgrounds. And so it's really hard when you're wanting to get someone who definitely needs mental health services, but let's just say, friend, they were like, I'm only going to speak to someone with my same background. And if there's not a lot of supply of mental health services or people in that profession with that background, then we're stuck. What's the next motive? What's the next option? So I think really digging in and making sure that in our communities that we have that we know who we are serving so that we can have a ultimate supply so that we have options, because if we don't have enough mental health providers, it's kind of hard. And if they're only wanting to talk to or speak to a woman, or I only want to speak to someone in my nationality or my background, and there's not enough to give them, we're stuck. What's the next
Mm-hmm.
level? Or having that trust to where they can go to someone outside of their comfort zone. How do we get that going? So I find a lot of that in mental health, and then just not knowing of the mental health symptoms or things that people go through.
And Panther, I wanna swing that back into what you're addressing, because we know that these problems and issues exist. How is it that you as a CHW, how is that support for your participant helping them in this area specifically? You know, knowing that you're there as a support. And so even though we might not be able to get them to that spot, how is it that you as a CHW are helping them out?
So what I feel like my hope with them is, one, just having that shared experience, saying, I understand, like knowing that what they're saying is valid, because a lot of times they talk and they don't feel like their voice is being heard. So one, I'm hearing you, I'm understanding that this is something that is bothering you. And that right there is just enough. A lot of times it's just like, wow, thank you, because everyone else thinks like I need to do this and do that. And it's like, no, I do hear you. I do understand this is an issue. Even if I'm not in the same situation or I've been, that's, I understand this is an issue. So I hear your voice. And then from there, it's okay. Well, these are the options. What would best for, like, do you like to talk? Like what are things that help you? So I just start trying to find things that they can do daily in their own lives until we can find that next step. And that is enough help right there. Is just, okay, I know at least, even if I'm having a bad day, I might be able to just to call you, and you can take that and go from there. So I think that's the main help, is just hearing that yes, this is an issue. No, you're not crazy or whatever people have put that title on you as. But what here's some little things we can do, and just finding ways to coming on their level, coming straight down to where they're at, and being like, okay, but this is the issue, but how do we resolve it?
Mm-hmm.
I would like to add to that. So
Yeah.
just like you said, Panther, a key thing is that shared experience. So, I personally, if I encounter someone that they probably could benefit from seeing a counselor or something, like I'll encourage them by, even sharing my own personal experience with behavioral health. One thing that that did come out of COVID is a boost in telehealth. So
Yeah.
like Panther said, there in Stark County, really in Ohio in general, there's a limited amount of diverse mental health providers. So the beauty of telehealth is that, I was able to find a counselor that looked like me, that I could relate to, and I visited with her virtually. Granted, not everybody is finds counseling or services beneficial virtually, but that is another avenue. One thing that I encourage with the CHWs and with all of my teams is self-care. So helping clients identify like what helps calm you, what like sort of centers you, because even if, maybe they're resistant to seeing a behavioral health professional for whatever reason, but if we can at least find some tools to add to their toolbox to help them really get centered and able to focus and meet the different needs that they need to take care of, that's helpful as well.
Perfect. Perfect. Thank you for sharing that. And I think that's where I want to show and demonstrate. We're seeing the problems. We know that there's issues. And this is a way that CHWs, hubs are coming together to figure out, okay, these are our challenges that we have. We don't have enough resources, but our CHWs are actually impacting the lives of our participants. And even just holding that hand, sometimes even a moment of a person just being able to cry and you know that you're just sitting there next to them has so much impact on this person's life, and figuring out, okay, let's give you your moment. I'm just going to sit here and I don't have to say anything, but I just want you to know that I'm here. And I think that's what we've been trying to encourage as a whole model is how do we find those individuals who are from the community, who get it, who are able to have that kind of impact on these lives, because a lot of people just feel lost. And having that special person right there, even if it's a stranger that we might look alike, but there's something about this person who just gave me their empathy in a time that I needed it the most. And so that's kind of what I wanted to navigate into of, this is hard and we are addressing some stuff, but that moment has so much impact in that person's life, it can really be a changer for them.
Yeah, absolutely. Such a great conversation. And yes, really appreciate you guys sharing some of your story. But Chanel, I'm going to come back to you again and ask you to share one more time. But you were doing this work. We've mentioned COVID a few times on the call, and you were doing this work during that time period. So share with us a little bit about your experience during those initial, potentially that initial moments of the pandemic, and really how were CHWs such a key piece with their participants in addressing that health literacy. And sort of none of us really knew what was going on, but what did you see, did you see with the CHWs as they engaged with their participants during that time to impact their understanding of what was going on?
So, wow, that was a rough time. Um, Definitely learning how to be quick on your feet. So pivoting at a moment's notice, you know, we while everybody's experiencing it at the same time, it's like you still had to try to be 2 steps ahead so that way you could navigate what was happening. So moving from paper releases of information to suddenly we're doing electronic releases of information. So making sure that the community health workers had the resources to be able to get that information to their clients or to their referrals, and navigating that, learning how to communicate, really just from home, like through email, utilizing all those resources, making sure that you're watching the CDC recommendations and then passing that information to the community health workers and trying to make sure that we have one voice, because there were so many different sources, and making sure that one, we're sticking to what the agency represents, but then also making sure that our partners, because our community health workers are not our employees, but we have to make sure that we're aligned with together, like, and it's just again that one voice, and that was very challenging. But even though nobody likes COVID, I'm grateful for where it took us, if that makes sense, because we learned, like, COVID was a horrible thing, but it also pushed us forward in so many ways. And then, you know, the businesses that sort of reverted back to what they were doing pre-pandemic, it's like, what are you thinking? Like, why would you go backwards? So there's a lot of lessons and things that hopefully I answered your question. But yeah, there was a lot of pivoting to take place, and I think that we proved who we are and what we can do during the pandemic, because even while many were at home, working on different arts and crafts projects in their home and home renovations, like our community health workers were still serving our clients and addressing those needs. So if it was dropping off a pack and play on their porch and having them sign a paper and then come back and grab that paper for our documentation to be uploaded, like we pivoted and we made things happen in a time when other people were like, how are you doing this? Like we still kept going. So
Yeah. Yeah, that's sort of where I wanted you to go with that, right? Just to say that, CHWs were key throughout that process and being able to continue to serve and teach others, right? We talked about porch pickups and drop offs and meetings where CHWs were like, listen, I got to see a client. I'm going and sitting on the front yard if I have to be able to service them. And so, really looking at, and in addition, the importance that CHWs had in bringing that information to their participants about what was going on, or kind of working through, what is this vaccine, how do I get get it, where can I go. And in addition to that, Chanel, you and I were working together during that time, and we talked about, right, our participants can't go to find a vaccine, we need to bring the vaccines into the communities, right? And so really being a key piece in that advocacy too, to say this is what our community needs. And part of that for me, when it comes to the idea of health literacy, is elevating that information up. And I think that's what CHWs are able to really do, is be able to elevate and advocate for the needs of their participants in the communities that they
I
serve.
I want to also share, and I'm glad you're bringing that up in the way that the CHWs were advocating, because at that time I worked previously for a hospital system, and the voices of the CHWs, like what Panther was talking about, hearing their voices, they were able to give that message back to the hospitals and say, hey, the patients are not understanding about these vaccinations, and we really got to deliver our message differently, because the literacy levels were all across the board from different communities. I don't care how educated you were, people were just lost because this was not their topic. It is not their expertise was not that. And so for those who are in the field, they can read it and be like, oh yeah, it makes sense. But I've seen lawyers, others from market higher departments, bankers, that you're like with all these degrees, but clueless when it came to the information. And so you really saw different people really show up in a light when we talk about health literacy, and we keep forgetting, like, oh, it's just because those who are low income or they don't know how to read, right? No, there's a lot of different components of health literacy on the messages that we're trying to deliver. And this is why people get a lot of times frustrated. And that's one thing that we even said to our public health system. We really lost a lot of people because of the misinformation, because it wasn't delivered correctly. And so, like when Chanel was saying, yes, you created these class standards, but you also have to apply these class standards coming from a public health system all the way down to the bottom. Like everybody has to figure this out. These points, or these messages on what we're trying to do and just health literacy, was that main component that was needed. People really just needed help to understand, and then they can make the decision. It didn't matter. And a lot of times even CHWs had to encounter that, say, hey, you still have a right to make a decision, but I want to make sure that I'm giving you everything as best as to my possibility, because I don't want you to make a wrong decision just because you didn't understand. Now, if you heard everything and you were like, this is my decision, then you have the autonomy to make that decision and you have to be respected, period. But the one thing we didn't want for people to go, well, I'm not doing it because of this. And I was like, no, that has nothing to do with that. And so how do we clarify that information? So that way they can make an honest decision with all the information on hand correctly. And that all that information of the hubs trying to figure that out, talking to the CHWs, them sharing the voices back, talking to the bigger systems. There was a lot of communication that was happening on like the realities that needed to happen. And it was all around this health literacy level. just to make sure that people were understanding the message correctly.
Yeah. And that's just one aspect, right? But really looking at this, it's a collaboration. It's bringing all of those voices to the table, whether it's the participant, the CHW, Chanel as the PCH director, or even us at PCHI, but all sitting down together to really look of how do we move this forward? How do we continue to empower our participants? Because really that's what we're looking to do, right? Being able to give them the resources and the understanding and the skill set and the education and all of those things, and really wrapping around and supporting them throughout the process. And so, Panther, we always will say that you are the key to this work. My original interaction with CHWs was through a drug court that we worked on together. And you know what? We had a magistrate or a judge who used to say all the time, these are the individuals who are key, right? The work that they're doing, being able to help their participants and get them connected to those resources and empower them along the way. So we're getting close to time here. But Panther, I would love for you to sort of be able to maybe wrap us up a little bit. If you have a story or an experience with a participant that you would share with the group on really, how to maybe, just give us a little bit of a brief synopsis of the work that you did with them, and kind of how did that change over time as you continue to engage with them?
Yeah, sure. So I had one participant who was living in low income housing, wasn't quite sure of the resources that was available to her. So we literally sat down after I grabbed our information, had a talk. We literally sat down and came up with a plan. We worked on budgeting. She wanted to work on getting employment. She wanted to work on teaching her son how to get potty trained for school. So when we listed these goals, we met every 2 weeks. I would come to her home, we would sit down, I say, how's, the budgeting going, how's your son going? And I would just give her information, resources, flyers, whatever she wanted, whatever she needed. If she wasn't able to print, I would print it out for her. Whatever was necessary to get her on her feet. She was able to land her a job. I actually just seen her not too long ago. She's still working. Her kids are in school. She had her nails done. It was just a different glow on her. And then I had one participant who came into my office just dealing with a lot of issues, a young girl crying her heart out. I mean, literally was just going through everything. Helped her out, gave her some resources. She disappeared on me for a few months. I got worried. I saw her at an event that I was at one day. She just came up to me, didn't even recognize her. She was like, I'm back in school and I got me a place, and I was able to connect. And it's those stories when it's on bad days, when you have someone who's having a rough day, you feel like you're not giving enough resources or enough help. It's those stories that make a difference, because in a shift of a moment, I was able to get back, like, they're doing well, they're prospering, they're thriving, they don't need me anymore. That's why she didn't call me back. She was able to use those resources and she got on her feet. And so those things are what makes going to not even work, but going to my career possible, because I know that I'm making a difference. I'm doing something for someone that I know I would have wanted for me. So yeah, that's it.
Well, thank you for sharing. And again, thank you for all the work that you do. It truly does not go unnoticed. And I always say, right, the work you do as a CHW is powerful, right? You truly do change people's lives. So cannot commend you enough for, participating and doing this work day in and day out, because you truly are making a difference. So thank you. I would love to go around and just give everybody an opportunity if there's any kind of lasting comments or thoughts that you would like to leave. And then I want to just spend the last few minutes asking, are there questions or comments that the group would like to share? We would love to be able to hear from you and answer anything that we can. So Panther, I know you just spoke, but anything else you want to add before we wrap up this evening?
Sure. Just if you are a organization that is servicing people in whatever community that you're in, just please make sure that every resource that you have is up to date. Just make sure that whatever we are providing for your community is up to date, because we are the trusted individuals. And if we get any information, of course, back that isn't going to help them, that hinders our job, that keeps the mistrust in place. So I would just encourage, always make sure, like Isaac said, check in, make sure you are checking with your community, make sure you're checking with your staff, make sure you are just on board with everything and know who you are serving.
Awesome. Thank you. So key. Chanel?
I would say to Panther, and any really anyone in any position serving the community, use your voice. Whether you're invited to the table or not, if you're not invited to the table, send a telegram, send an email, send a note. Use your voice, because you never know whose ear you may have. Um, you know, there's different, if an opportunity presents itself to speak and voice a concern or a need in the community, use it. I I feel like that's how I've been able to push our program to where it's at. Is I'm the squeaky wheel. So if I get your attention for a moment, I'm gonna drop that bomb, and hopefully you carry it to the right person, you know. And I think that it's led to some of the connections that we've been able to make. You know, even recently, you know, I had a call with a federal agency that was completely unexpected, and you know, that conversation has led to them investigating some other things to open other doors for our program. So, you know, use your voice. Don't think that your voice is pointless or nobody's listening. It doesn't matter. Like, just keep using it. That's all I can say, because you never know who is going to hear what you have to say, and they're going to check in and make sure that those issues are addressed.
Yes, absolutely. And again, thank you, Chanel, as well. Without you being the leader and doing this work in your community, right? It wouldn't exist. So we appreciate all that you do day in and day out to serve not just your CHWs, but your community as well. So, Isaac, any
Yeah.
last comments?
So, for me, I would like to encourage all of you to really understand the concept of health literacy in an overarching component, because a lot of times we get bogged down with reading levels, but it is more than that. And your message is what you're trying to get across the board for a lot of people. There's a lot of methods that can help communicate. The one thing I always like to tease with is with IKEA. IKEA sells a lot of products to multiple around the world. They do not translate. They use images and that's it. And everybody, it's like a universal language. It's great when you see things like that, but that kind of ideas is what we need to communicate to our communities. Use out of the box methods. Think of other things that can be very helpful for the people. Ask them and check in and see if does that work for them. I think a lot of times we bog down with all these methods and we don't realize there's other options out there that we can utilize. So think of a broader view, but also know how it checks into your class standards, because it does check in. Because the idea is to fit it for the people. It never says fit it for the system. It says fit it for the people. And so, are you fitting it for the people? And if you're not, then you're not following the class standards. You're only following your own rules. So, think a lot more about how you make that impact and how you really connect to the people who are at the ground. And listen to those voices. We utilize a lot of our CHWs and their voice because they're the ones seeing the real stories. At the end of the day, we still have to listen to them and go, that's the reality that they're facing. We got to figure out how to way to make our own model, our systems, how do we improve it? Because they're the ones who have to face the people that are on the ground and they're ones that showing that support. And I'll pass it to you, Mary.
All right. Well, thank you. I love that, Isaac. Fit it to the people. That's going to be my new slogan. But absolutely love it. So, well, you know, again, great conversation today. I appreciate all of you and your just, you know, your insight and your experience, and being able to share with this group as we looked at not just the model itself, but the work that's going on in many communities across the country. So, uh, just a moment. I think we have a few moments left. Are there any questions, comments, thoughts that we as a team can be helpful with or to engage with at this point? But we'll use the last few minutes just to allow anybody to feel free to raise your hand, type in chat.
There's a question. Danielle, please feel free to ask your question.
Hey,
Hello.
thank you. I appreciated this talk. I guess my question is, I am the acting director of community health for a supportive housing agency, and one of our grant-funded programs that we've been able to do is sponsor our tenants to get community health worker certificates, and that's something that we're really proud of. However, it's been a struggle to get them employed. And I just didn't know, since you all are working with a community health worker model, if you had any advice for helping them kind of break into the field.
That's a good question. So I know Chanel, right? You work underneath the PCHI model, and that's how this kind of relationship has been developed. But you know, just for any CHW, I know you work with a lot of different community members or organizations, right, within your community. So, how do you have any advice on how to break into this beyond just the
Yes.
model itself?
I would say definitely tap into your community partners. So a lot of times, community health worker is one term that there's multiple names for community health workers. So, you know, definitely think outside of the box. Don't box yourself in based on them getting the community health worker certificate. So look into like social work assistant positions, look into see if there are people that are willing to be creative and give them a chance. If they are willing to create a position, or just look at what positions they have that are connecting their clients to the resources in the community. So community resource navigators, neighborhood navigators, things of that sort. So check your public health departments, check those grassroots organizations, because honestly, I feel like the hospital systems and everything, they're nice, but those grassroots organizations, those are the players that are really willing to come to the table and usually help you get that off the ground. So I would definitely tap into those.
Can I add something too? And I love that Chanel brought working with the community organizations. I think that's one thing that we, a lot of times, because grants come through and there might be opportunities to start positions and then help them in that sustainability and saying, hey, we can come together, we'll hire these, you will hire them specifically from that are coming from our program into your program as a way to kind of bring them through. But then at the same time, they're also creating these positions that are helpful for getting the community to kind of work together. And so I think it's important that we reach out to other organizations that might need that support, that need someone like a community health worker, patient navigator, whatever the name is, to do this type of work. That's one thing that we do encourage, like with PCHI as a model, hubs are the people who are on the ground working with the communities, and then figuring out how do we bring everybody to the table and how do we work together, because there might be people that we might need community health workers. Like there was a conversation of getting community health workers in schools, because the nurses are able to work, but children are going hungry or they can't wash their clothes. And then the CHWs can work with those parents of those kids. And that was a way of bringing them around, getting them wraparound services. But that was a discussion of where do we go? And oh, look, this is a place that we need to hire CHWs. Look, now we need to go train CHWs. And then the hubs are helping figure out, okay, how do we work together to find grants to help support this? So if that's where you're at, I think even bringing that in will be a good way. I'm sorry I took up the last. last time.
Nope, that's okay. I think we're at a hard stop at 6 o'clock though. So thank you to all of you for your participation. We appreciate you being here. And you always can find more information at pchi-hub.org. So thank you, everyone. Have a great evening.